Truth is, most adults aren't keeping up with their own medications. A new study says 40 to 60% of patients cannot accurately recall what medicines they take. Americans weed through a collection of prescription, over-the-counter, and herbal medicines. Lack of understanding those medications is a national problem. Rex pharmacist Christine Zone is spearheading a local effort to change the trend.
Patients do not have a current, accurate, and complete list of their medications when they come to see us. We're talking about hospitals, retail pharmacists, physician office practices. Those patients who see 2 physicians have an average of 27 prescriptions a year. Think of keeping up with that list. And we know that those patients have a potential to have up to 10 medication errors a year.
I try to keep a list current on my computer, but it's very difficult to because of the changes that are occurring, because of the various illnesses that I'm dealing with.
How many different medications are you taking currently?
Currently I'm taking 23.
These are the kind of cards we'd like for patients to ask for and keep. We like them to keep them in their wallet. Keep it right there with your insurance card for your health insurance. And if something tragic were to happen on your way to work today and you had to be in the emergency room, we want to have access to that list right then.
Beyond listing your medications, understand how they work and take them as instructed.
A lot of patients won't continue for a full course of therapy on an antibiotic, for example, and that can certainly have a detrimental outcome. What's happened is the organisms have been slowed down, but they're not stopped, and they're going to come back with a vengeance.
While an over-the-counter drug or herbal medicine may be perfectly safe, mixing them with prescription drugs can be anything but.
An excellent example would be a patient who's taking a blood-thinning drug, such as warfarin. There are herbal medications like ginkgo, St. John's wort, garlic, and ginseng that can add to the effects of the blood-thinning drug and cause the patient to be at a higher risk of having a bleeding event.
It's $13.25.
The most valuable advice?
Now, if you would like, the pharmacist is available to answer any questions you may have about that medication today.
Thank you, I'd like that.
Take up the offer for your pharmacist advice.